All right, this is Joe Johnson of Cancer Dudes Live More, and today I have a special guest with me, Dr. Dominic D'Agostino, who is a professor at the University of South Florida. And he's doing really a lot of interesting research on metabolic treatments for neurological disorders like seizures and Alzheimer's, ALS. And also what we're going to talk about today is metabolic treatments for cancer. A lot of very interesting research that he's doing down there. And I'm very excited to have him with me today to educate us on some of the work that he's doing and also how that can be applied to people with cancer. So thank you, Dominic, for coming on with me today. I really appreciate it.
Thanks for having me.
So I know you do a lot of work with the ketogenic diet and how that can have an effect on cancer. Can you explain a little bit maybe about some of the work that you're doing and also, just kind of a general overview for someone who's not so familiar with the ketogenic diet? Why might it have advantages for cancer?
Okay. I originally got into this to kind of develop a ketogenic diet strategy to prevent seizures in Navy SEAL divers that get oxygen toxicity, which causes seizures. And I had some friends and some people that I knew that had seizures, kind of what you would call terminal epilepsy. Mm-hmm. Mike Dancer is actually one of them, and he's an adult that I was connected with, and he successfully used the ketogenic diet to manage very severe epilepsy. And this is it's going back about 4 or 5 years ago now. And, as a research kind of developed as for ketosis having an anti-seizure effect, I stumbled across the writings of Thomas Seifert, who did research in seizures, but also did research on cancer. And he found, in his words, the ketogenic diet, or lowering blood glucose and elevating blood ketones, was a very successful strategy that he called metabolic therapy that could be used, in place of the standard of care. Mm-hmm. And I became very kind of engaged in this idea of metabolically managing cancer with a ketogenic diet or calorie restriction. But we believe now that calorie restriction probably isn't as important as creating nutritional ketosis and sustaining that, mm-hmm. which keeps blood sugar low and stable, and it prevents spikes in blood glucose and blood insulin, which can drive cancer growth and proliferation. Mm-hmm. So that's the advantage of the ketogenic diet. So mm-hmm. it can, it metabolically kind of manages the hormones, the blood glucose and hormones that are the drivers for cancer growth, mm-hmm. and that drive the downstream pathways that result in aggressive cancer growth. Mm-hmm. So if you can maintain that and elevate blood levels of ketones, where your normal cells kind of run off glucose primarily for fuel. If nutritional ketosis forces a physiological shift from a glucose-based metabolism to a fatty acid and ketone metabolism. Mm-hmm. And the advantage here for metabolic management of cancer is that your normal cells can readily adapt to using ketone bodies for fuel. And cancer cells do not have the metabolic flexibility to allow them to readily adapt and to derive energy from ketones as normal cells do. So creating a physiological shift from a glucose-based metabolism to a fatty acid and ketone metabolism has an anti-cancer effect. So we think that this can kind of weaken and stall the growth of cancer. Probably it's not a cure in any stretch of the imagination, but in some people it is. I'm in contact with some people, for example, Dr. Fred Hatfield that used it. He was one of the first people that contacted me, and actually I have a list of people who contacted me by email that have been metabolically managing their cancer with a ketogenic diet, mm-hmm. or a calorie-restricted ketogenic diet. Mm-hmm. So it metabolically produces a physiological shift in the metabolism that can, I think starving cancer, saying you're starving cancer is a little over the top, but I think it limits glucose availability to the cancer cells, therefore restricting their growth. And I think if the person is healthy, with an intact immune system and kind of follows up with all the other things that can promote good health, psychological, exercise, fresh air, and just kind of doing a more of a holistic approach, I think metabolic therapy in the form of a ketogenic diet or restricted ketogenic diet can be an effective approach that could potentially put someone into remission that has cancer. I've seen that. But I think at the very least, it puts metabolic stress on tumor cells and compromises their function, and it makes the cancer cells vulnerable to any modality that's added on top of that. Whether it be we're doing some work with hyperbaric oxygen, which has very interesting anti-cancer effects. When you saturate a tumor with oxygen, it can reverse, turn off some of the oncogenes. It also, reversing tumor hypoxia can cause, or saturating a tumor with oxygen can cause cancer cells to overproduce oxygen-free radicals. And since cancer cells have damaged mitochondria, the mitochondria will overproduce reactive oxygen species, and it can turn on pro-apoptotic mechanisms. So apoptosis is kind of programmed cell death, you might be familiar with. And this oxygen is a powerful stimulator of apoptosis in cancer cells relative to normal cells. It can be toxic to normal cells, and it all depends on the dose. But cancer cells are selectively vulnerable to hyperoxia-induced oxidative stress. So what that simply means is that oxygen will be more toxic to cancer cells than normal cells. And the reason for that is that cancer cells have defective mitochondria and various pathways that kind of cause an overproduction of oxygen-free radicals, and it overwhelms their endogenous antioxidant mechanisms to make them selectively vulnerable to the oxygen. So a combination of metabolic therapy in the form of ketogenic diet and hyperbaric oxygen, we have shown that it can be effective to metabolically manage metastatic cancer and some of the more aggressive cancers in animal models. And what we don't know is the optimal strategy for hyperbaric oxygen. Simply breathing 100% oxygen at normal baric pressure instead of being inside a chamber would have a similar effect. Probably not. Unfortunately, someone will probably need to use hyperbaric oxygen as it's medically used for a variety of different disorders. So we're at that point now where we're kind of fumbling around with, we know the ketogenic diet is pretty effective, and we know hyperbaric oxygen is, but we don't know the dose. And then we have a toolbox, if you will, of agents that can therapeutically elevate blood ketone levels, and these are ketone esters. And we've done some work with these. They have a very strong anti-seizure effect and an anti-cancer effect. And we've published the seizure stuff, and we're about to publish the anti-cancer effects of ketone esters. And we think that this is very promising. This can put someone into a state of nutritional therapeutic ketosis without severe carbohydrate restriction. Although I do feel carb restriction is necessary to limit cancer growth, it can help someone transition from a standard diet, ketogenic diet, without the glucose withdrawal that you go through in the brain. When the brain is craving glucose, the hunger, we can probably circumvent, all that physiological effect with a ketone-based supplement. And now the toolbox of other anti-cancer agents may include things like 2-deoxyglucose, which is glucose, but it's in a form that the cells can't use. So the cells take it up, and it can inhibit the glycolytic pathways inside the tumor cells and have an anti-cancer effect. Dichloroacetate, DCA, metformin, some of these, sodium phenylbutyrate. These are relatively common drugs that are not utilized, currently utilized as an anti-cancer strategy. They're all relatively non-toxic, and we think that when they're combined with a ketogenic diet, hyperbaric oxygen, and ketogenic agents, and metabolic drugs, it sounds like a daunting array of therapies, but the advantage is that compared to chemotherapy, it's non-toxic. And it's relatively inexpensive.
Mm-hmm.
And we know from a science point of view, the scientific rationale is there that these are very powerful anti-cancer properties of each of the things I described in isolation. And when they're combined together, they likely produce a synergy that we're now just realizing that can be above and beyond any form of cancer therapy that's currently being used.
Mm-hmm.
And maybe this can be used, metabolic therapy, as its own therapy, but it will most likely work well on its own, but it will most likely make the standard of care more effective.
Mm-hmm.
And there's already reports, 2 published papers showing that if you fast for 24 hours prior to radiation or prior to chemotherapy, that it makes cancer cells more vulnerable and the patients have a better outcome.
Mm-hmm.
And it also decreases some of the side effects associated with the standard of care.
Mm-hmm.
So that's simply fasting, short-term fasting, 24 hours, kind of puts a person into mild ketosis, lowers blood glucose. It seems to be can synergize with the standard of care. So we can only imagine that a very aggressive metabolic therapy and combined with the standard of care would be very effective.
Mm-hmm. Mm-hmm.
So what my role is now, and my collaborators too, when I talk about my research, I'm also talking about the research of Thomas Seifert from Boston College,
Mm-hmm.
who's written a book called Cancer as a Metabolic Disease. And it's a very informative, very powerful book that describes the science behind what we're doing. And it also has patient protocols in there that can be followed to implement metabolic therapy. So the research that I'm doing with Thomas Seifert right now is to really nail down the most aggressive strategy that can be used, that can be implemented in a patient, with the approach to that really patient compliance is very important. And what we've had issues with is that calorie restriction and fasting, it's hard for patients to do.
Mm-hmm.
So if we can minimize the calorie restriction component and the duration that the patient needs to fast in order to get into the metabolic zone, we call it. And the metabolic zone, the definition is that your blood ketones are elevated up to the level approximately of your blood glucose.
Mm-hmm.
So getting glucose to 70 millimolar per deciliter, 70 milligrams per deciliter, which is roughly about 3 millimolar, and getting ketones to the same level
mm-hmm.
is in millimolar, 3 millimolar, is
mm-hmm.
pretty tough to do.
Mm-hmm.
But if a patient can achieve that, then that usually confers, protection against further growth of cancer cells. It can be used to metabolically manage cancer cells. So we know that scientifically, and we know that case reports of people who are able to do this. The issue arises with the implementation, the long-term implementation of a metabolic strategy that maintains these blood biomarkers within that metabolic zone
mm-hmm.
and sustaining it. And this is what we really need to work out.
Mm-hmm.
So we're thinking more of an ad libitum ketogenic diet, kind of like a modified Atkins diet with a ketone supplement
mm-hmm.
on top of that.
Mm-hmm.
And periodic intermittent fasting, for example, a 24-hour fast once or twice a week with a ketogenic diet eaten ad libitum,
mm-hmm.
And maybe some ketone supplements on top of that.
Mm-hmm.
So developing, and you can kind of, conceive of this as being something that you can follow through with. Some of the things that we do in our animal models are things that people will likely not be able to follow through with because we can control many aspects of their diet, the calorie consumption, the carbohydrate consumption.
Mm-hmm.
So I think what's most important is that we package this therapy in a way that can be successfully implemented
mm-hmm.
by the patient without a lot of stress. I think food is very important from a psychological perspective. It's a source of enjoyment, and it should be kept as a source of enjoyment. And I eat a ketogenic diet. I've been eating this way for about 5 years, and I know it can be enjoyable. I like fatty foods that are salty, and
mm-hmm.
My protein is kind of moderate, and I enjoy eating this way.
Mm-hmm.
So, and I think patients or people should not be deprived of that enjoyment.
Mm-hmm.
So not only do we do the science, we kind of work out the implementation point of it. And I'm working with some nutrition companies that are hopefully in the near future they will develop a line of prepackaged ketogenic foods that can be used, that taste really good, and that can be purchased, and when eaten, they help the patient achieve nutritional ketosis. So there are low protein or low carb, high protein foods out there, like Atkins, for example, and that when you eat them, you're following a low carb diet, but they don't produce nutritional ketosis. So they don't hit the macronutrient ratios that can help a person sustain nutritional ketosis, I should say. So I think these foods need to be developed, and I'm working with some companies, and hopefully they'll do that pretty soon. So that can help with the compliance part of it. And I think the information that you put out there is great. That's also a very valuable resource to the patients, and all the different links you put up. Ellen Davis maintains a website called KetogenicDietResource.com. It's a resource that I send people to, and that kind of gives them the foundation that they need to successfully implement some of the nutritional strategies that we're testing.
All right, great. Yeah, that's awesome. A lot of information in there, and I'm just curious about the implementation. No, that's awesome.
That's well there, yeah.
So what are typical macronutrient ranges that people need to be in to get into that nutritional ketosis? Have you found?
Well, I think it's important to keep carbohydrates as low as possible, but at the same time, you want to get a lot of green vegetables in, because there's a lot of benefits that can be derived from not only the fiber but the micronutrients. In, for example, broccoli, asparagus, green leafy vegetables. There's a variety of things that can be eaten, and this can be made into soups or stews or what have you. But as far as macronutrient ratios, so keep carbohydrates, probably under 50 grams per day for sure, unless you're an athlete. And I think you can kind of get away. I know I'm in contact with some athletes that get about 150 grams of carbs a day, and they keep their ketones elevated just because their energy output is so high. But typically under 50 grams of carbohydrates a day, preferably high fiber things like eat a lot of salads, green vegetables, asparagus, broccoli, cauliflower, avocado. Nuts are kind of a little bit of carbohydrates in there, but mostly fat. And protein, you want to keep around 20 to 25% of the diet. Protein, actually 15 to 25% of calories can be protein, and the rest fats. And we try to derive, from the best sources: eggs, chicken, fish, beef, avocado, nuts, all types of nuts. I try to minimize actually meat consumption more recently over the last couple of years, and I try to get most of my protein from fish, small fish like sardines, eggs. So eggs and fish and nuts are a pretty big staple for me. I've been kind of interested. I approached where I met you at the Ancestral Health Meeting Symposium. I saw this poster on cricket flour or cricket protein.
Right.
So protein from insects, and I'm trying to always eat lower on the food chain. So it's something that I'm interested in. I'll probably be contacting the vendor there and seeing maybe if he'd be amenable to creating some kind of ketogenic diet bar with cricket powder. And I'm actually interested in using that form of protein for my scientific research, because as of now we're using a casein, a dairy-based protein in animal research. It's pretty common, but it's not common for rodents to eat bovine protein, right? Casein, so which has some maybe some effects on the immune system and some intolerance effects. But the insect protein is something on the horizon that I want to look into. But generally speaking, just going back to your original question, as far as percentage of calories, 5% carbs, 20% protein, and like 75% fat. And I vary the protein up to 40% per day on some days as high as 50% if my activity level is really high. But generally, I need to moderately restrict protein to sustain nutritional ketosis, because if you eat too much protein, it can convert to glucose through the gluconeogenic pathway, and it can kind of knock you out of ketosis. So there needs to be a level of protein restriction, and this is covered very, very nicely in Dr. Jeff Volek's book. It's called The Art and Science of Low Carbohydrate Living, or The Art and Science of Low Carbohydrate Performance. So these are the two books out there that are very informative. And Jeff is kind of a friend and collaborator of mine, and has done a lot of work on exercise performance and the ketogenic diet. And these are the two books I recommend people just to read right off the bat, and then that gives them the information that they need to get them into nutritional ketosis. And a lot of people that I talk with are using it for athletic performance. Some are using it to manage epilepsy, and some are using it to manage cancer. I think it's kind of one and the same, right? But I think there's enough flexibility in the diet and enough food selection that you can design a palatable diet that can help you achieve the goal that you're after, whether it be metabolic management of some kind of disorder, or to kind of wean yourself off a carbohydrate-based diet to get your body burning fats more efficiently for athletic performance. And I found personally that from a practical point of view, I can eat less meals per day and maintain my exercise performance, but also I don't get as hungry. I can eat 2 meals per day. I kind of wake up early in the morning and have butter in my coffee and go a couple hours working, and then I'll eat a mid-morning breakfast. That's pretty big. And then later in the day, in the early evening, usually after a workout, if I can fit in a workout, I'll eat my second meal, which would be, high fat, moderate protein, very low carbohydrate diet. It could be, some salmon put on a salad and, with olive oil and spices on top of that, or some kind of soup with steak and asparagus, or, it's kind of 2 of my last meals off the top of my head,
Right. And
so from a practical point of view, it's kind of liberating in that it's not a crisis situation when my body gets hungry. So if my blood glucose gets low, ketone bodies are providing energy to my brain and kind of sending the signal, you're okay, you have enough energy. And whereas if you're on a carbohydrate-based diet, when your blood glucose goes low, a couple hours after eating a big meal, because you spiked insulin, the transient hypoglycemia can cause, a crisis situation where, like, I got to eat, I got a headache, I'm feeling a little dizzy, I got to eat something. You don't get any of that when your body is what we say keto adapted, and you're in sustained nutritional ketosis. You feel perfectly fine if you go a couple hours without eating, if you skip a meal.
Right.
And that's, from a practical point of view, that's a huge advantage. If I'm running an experiment in the lab and it's a 12-hour experiment, I don't have to worry about grabbing a meal. I can kind of work through what I need to work through and just get a meal at the end of it. Or if I'm traveling, I don't have to worry about food on the plane. And when I sit down and eat a meal, I don't have to restrict calories so much because I'm only eating 2 per day. So I can sit down and eat until I'm comfortably full, and then leave the dinner table and be fine and not kind of guilty that I've eaten too much.
Right.
It's controlled. So
yeah.
So there's health benefits to a ketogenic based diet. There's from a cancer point of view, obviously there's practical advantages as far as meal frequency can be reduced, and there's performance enhancement benefits from athletes or endurance athletes that are using it now to enhance prolonged exercise performance.
Right. Yeah, I really had the same experience as well, transitioning more of my diet to healthy fats. Now I can go, a day without eating anything. I just fasted for 4 days last week, and it was no big deal. Whereas a couple of years ago, when I was eating so much grains and starches and fruit, and you got to eat every 2 or 3 hours or so. So it's really it's kind of amazing. It just opens up so many new possibilities, and you just feel so much more stable all the time throughout the day. So it's really impressive.
Yeah.
But so you mentioned fasting. Do you think that is important for someone with cancer to implement? I know the therapeutic fast, as you were mentioning.
Yeah, I do think it's important. I think the advantage of fasting is that it gets the body into the metabolic zone quicker. Mm-hmm. So it's theoretically the fastest way you can lower your blood glucose and elevate ketone bodies. Mm-hmm. And if the initial fasting is done in combination with a ketogenic supplement, mm-hmm. At the lowest level, coconut oil or MCT oil, it can help alleviate some of the hypoglycemic effects mm-hmm. that you may get from initiating the fast. Mm-hmm. And also, it's important to sodium load or get some salts in when you're fasting, because mm-hmm. it has a diuretic effect. Mm-hmm. So it's important to get in lots of fluids, get in minerals, sodium, potassium, magnesium. Some people get cramps, and magnesium can prevent that. Mm-hmm. And I think it's as simple as just maybe drinking some soup broth, or having mm-hmm. a bowl of soup broth, and mm-hmm. Just getting, ensuring hydration is good during the time you're fasting. Mm-hmm. But the advantage if you're doing this to manage cancer, the advantage of an initial fast is that it lowers blood glucose as quickly as possible, mm-hmm. and it gets ketone bodies elevated. Mm-hmm. Now, someone may panic because the first 24 hours, your morning glucose may be elevated because your body perceives a lack of food as a physiological stress. So it's going to release cortisol, it's going to elevate stress hormones like adrenaline, mm-hmm. epinephrine. Mm-hmm. And these things, activation of the sympathetic nervous system, can actually cause your blood glucose to go up and mobilizes stored glycogen and things like that. And this is a typical stress response that I've seen in people. Mm-hmm. So, and this occurs in the first 24 hours or so, and then after about 48 to 72 hours, that can be, your body is really starting to, your brain, I should say, is starting to wean off of glucose and get adapted to the ketone bodies that mm-hmm. your liver is now producing. Mm-hmm. And by like the fourth day, at least in me, and it varies between people, and fifth day, you're kind of comfortably in this, this fasting ketosis, mm-hmm. and your appetite can be controlled, but the pleasure of wanting to eat is usually still there. Like I found it interesting that I had like no appetite at all at like day 4 or 5, mm-hmm. but I just really missed the enjoyment of eating, mm-hmm. and I don't think fasting should be done for prolonged periods of time. Short-term fasting can be therapeutic, but calorie restriction and prolonged fasting is just not a very practical, not a very healthy solution. I'm a big believer in the ketogenic diet maintained, within reason, and short-term fasting. But there was some reports of people trying to do like 30-day fasts or 2 weeks of fasting, and it's just too much stress for the body, mm-hmm. unless you're very overweight. Mm-hmm. And say if a patient was recently diagnosed with cancer and they have a BMI of like 35, 40 or something, I think a 1 week to 2 week fast could be appropriate for that person. Mm-hmm. But if a person has a normal body weight and wants to implement this approach, more than 5 to 7 days of fasting is probably not a good idea. Mm-hmm. And it's probably not a good idea if they do follow a ketogenic diet, it's probably not a good idea to restrict calories mm-hmm. on top of that. Mm-hmm. Thomas Seifert and I kind of debate this a little bit. He was more on the restriction part of the ketogenic diet, mm-hmm. But as we do research together, he's seeing that restriction is probably not as important. So we're kind of softening up on the restriction. And I was talking with Colin Champ from the Ancestral Health Symposium, and we had a real good conversation. And the feedback that he's seen, and the evidence, I should say, is that intermittent fasting, so following a carbohydrate restricted diet and fasting, for example, 24 hours prior to radiation treatment, can improve the outcome in his patients. They get less side effects and they get a better response to radiation. Is pretty much what he was telling me. And he's of the opinion that if you restrict total calories continuously, you're going to impair the health of the patient. And I tend to agree with him in some ways, and I think it depends. If the person's overweight, that's another story. But if the person has a healthy body weight already, restricting calories can be problematic. So I'm kind of inclined to go with some of the observations that he's seen as far as an ad libitum ketogenic diet combined with periods of intermittent fasting for 24 hours. And in his case, he treats patients with a standard of care and just fasts them 24 hours before they come in and get, radiation treatment. I think maybe 2 or 3 times a week, something like that. And it's all, I feel like we're fumbling around, with what the best solution would be. And we know that it can work, metabolic therapy can work, but I think a lot of research needs to be done. And for this research to be done, it needs money. And we need to nail down the optimal strategies in the various models that we have, animal models. And then from the preclinical studies, we can transition that into the clinic. And it takes funding to do this. And, the government agencies are not very amenable to funding some of these nutritional approaches to cancer. And that's a problem I run into. Now, I'm working with a couple companies. Cibation Nutrition has been extremely generous. They see this work, and they have some personal stories associated with their company, and kind of given us some funds initially to get some pilot studies done. And a number of other foundations, Single Cause, Single Cure, are interested in funding this kind of research. But we really need to get out there and write as many grants as we can to different foundations and government agencies, but just to also, just seek the funding that we need to really, test these therapies, because the scientific rationale is there. What we lack is optimizing the approach to the patient. So I'm working with a few key investigators, to get this done.
And kind of in the research that you've done, how do you find that this ketogenic diet and hyperbaric oxygen approach, how does it compare to like chemotherapy and radiation as far as effectiveness and also for toxicity and recurrence of cancer coming back down the road? What have you kind of seen in your research?
Well, this therapy is so new, we really don't have an answer to that. But in our animal models, what we can do is the response that we get is above what we have seen with the chemotherapy drugs. And this is a combination of ketogenic diet and hyperbaric oxygen. And there's, also that there's a problem that physicians will not support this therapy for their patients. When their patients come to them with this information, the doctors are not educated in nutrition, for one thing. I teach at a medical college, so I know that the nutrition education is very poor there, and this is way above and beyond kind of what they're taught. I think we need to change that, and that's another topic of discussion. But so the doctors really aren't educated in this approach, for one thing, so they're not going to support it. So what I get, the feedback that I'm getting, is patients that are doing this on their own, unfortunately, and we need to create a list of doctors, a list of clinics that are amenable to at least following these patients and tracking them, their scans, their blood markers of different proteins that are cancer markers, and to follow them over time. And the feedback that I'm getting from patients that are trying this on their own, or some are being assisted by doctors, is pretty much all positive or neutral. And, occasionally I'll get someone with advanced cancer that'll say, that was given 3 months to live, and, a year or so later they're saying, well, I'm not cured of cancer yet, but the tumors are still the same size, so they view that as like, well, when's this going to cure me? But they're kind of living their life, doing their normal things, exercising and everything, but when they go and get their, the tumors are still there, but they're small, they're not growing, and there's a few patients that were kind of frustrated. Well, when are they going to disappear? I don't think by any stretch of the imagination that the ketogenic diet is going to be a cure for most people. Even for some, there's been reports that it has been. But I think at the very least, it puts metabolic stress on tumor cells and just slows the growth of tumors. And I think compared to what other tools do we have out there, chemotherapy, which basically destroys your immune system, the chemotherapeutic agents that are most effective, that have the best outcome, they destroy your intestinal mucosa and put the patient into ketosis. But it's a toxic approach. So the patient is put into ketosis. Cancer patients put on chemo lose a tremendous amount of weight. That's because the cells that are rapidly dividing, are shut down. They stop dividing. And so that includes your hair, right, your nails, and your gastrointestinal tract. So you can't effectively absorb and utilize nutrients that you're eating. So in a way, it inadvertently produces a state of calorie restriction and even toxic ketosis, not nutritional ketosis. It produces toxic ketosis. And if you talk to, I'm in contact with a number of patients that have they say they successfully did chemotherapy, they're in remission. And one common thing I see in them is that they all lost a significant amount of weight. I believe the same thing can be achieved without destroying your immune system with a non-toxic approach. Because the immune system will be key for long-term management of cancer, long-term sustained remission. Because when you knock out the immune system, that's knocking out your body's ability to attack the cancer cells. And, chemo drugs may knock out a lot of the cancer cells, but if your immune system is knocked out, the few remaining, and there will be a few cancer cells remaining after chemo, most likely, the few cells remaining will be able to grow and divide, months to years later. And this will do this much more aggressively if your immune system is knocked out. So if we can achieve the same effect of killing cancer or knocking it down, 99.9% of it, and maintaining your immune system can likely come in and attack the remaining cancer cells. And to some extent, cancer is a failure of the immune system to recognize and destroy these dividing cells.
Right.
So we want to develop a strategy that maintains your normal physiological health and immune system.
Right. And now you were talking about the hyperbaric oxygen. Do you know, or have you had experience with people, how can they get, if they can't access a hyperbaric oxygen chamber, is exercise helpful, or deep breathing, or some other type of oxygen therapy, or any of those things? Have you found those to be helpful?
I think so, in a different way, right? I mean, I think exercise is basically a form of metabolic therapy. Right. So you're activating the mitochondria, you're stimulating the most metabolically active tissue in your body, really, which is, your skeletal muscle. So you're promoting, calorie utilization through your skeletal muscle, but your skeletal muscle is also a big glucose sponge, right? So you can dispose of glucose in your skeletal muscle, which is kind of burning it up for energy. So I think, and it just promotes overall cellular respiration, kind of vigorous exercise, not too strenuous, especially for cancer cells, because you don't want to impair their immune system more. You don't want to do too much stress. But I think exercise, breathing, stress reduction, these are all important factors. Hydration status, just make sure your body is well hydrated. And get a lot of questions. People can't afford hyperbaric oxygen therapy, and the insurance will only cover it if it's for radiation necrosis. So if you have cancer, but if you've had radiation, then cancer patients can get their insurance to cover it. Otherwise, it can be as much as $250 per session. I've seen it as low as maybe $40 per session, but that's kind of rare. So patients ask, well, can I just buy from a medical supply a 100% oxygen tank, and breathe with a mask, 100% oxygen at normal pressure without the increased barometric pressure? And will this be effective? There is some evidence that it will be. There's 2 reports published with normal baric hyperoxia, at least in an animal model. We don't know the answer to that question, but I'm inclined to believe that it would have a therapeutic effect. That simply breathing 100% oxygen, 3 times per week for 60 to 90 minutes would likely have a tumor suppression effect when it's combined with other therapies, like when you get your body into the metabolic zone. So in that way, it's delivering a little more oxygen, but hyperbaric oxygen is more effective because the oxygen carrying capacity of hemoglobin is already saturated, but you dissolve more oxygen into your blood. So the dissolved oxygen is at a higher concentration. And what that simply means is that the level of oxygenation in the tumor will go up significantly higher inside hyperbaric oxygen relative to just breathing 100% oxygen off a mask, like football players do on a sideline or something like that. They promote at these oxygen bars. You really need to increase the barometric pressure to elevate PO2 inside the tumor. So, so can a patient do? They can, we haven't studied it yet, but they could breathe 100% oxygen, and we think that may have a mild therapeutic effect. Or, alternatively, they can purchase a soft shell hyperbaric chamber that can go up to a maximum of about 1.3 atmospheres of oxygen. So we call this mild hyperbaric oxygen. And these chambers can be bought for, about $5,000. On eBay, you get them used for as low as $1,500, I've seen. Or you can rent them for something like $100 a week, so relatively cheap. I see them, they lease them out to different people. And these soft shell chambers are used for mountain climbing. They're used, for a variety of different things. I think maybe divers will use them on a boat for decompression sickness. And there's less science behind them because they go to lower levels of hyperbaric oxygen. But the next study we're going to do actually is to determine whether mild hyperbaric oxygen has a similar therapeutic effect and extension of survival in animal models. And I think from a very practical perspective, it's very important to see this, because if that is the case, then I would probably start progressively promoting or trying to get the knowledge out there that people can buy these soft shell chambers and derive a therapeutic benefit from it. So we really need to do the study. I'm uncomfortable promoting anything that's not backed by science. Even if I get anecdotal reports in from patients that say it, I'm a scientist. I need to see the hard evidence. We need to screen this with animal models and and determine what the optimal protocol is. So I can say what I would do. I can give my opinion, but I can't really promote it.
Right, sure. And now you mentioned the ketone esters. Are those something that kind of the lay public can purchase, or is that just in your studies, or how does those work?
Yeah, well, the ketone esters were developed and tested as part of a military-funded project. The Office of Navy Research, which is part of the Department of Defense, is interested in enhancing the Navy SEAL divers' resilience to extreme levels of oxygen that they might get by using a rebreathing apparatus when they do their dive operations. So they get at higher levels of oxygen, they can get oxygen toxicity, which manifests itself as a seizure. So they're also interested in enhancing the cognitive and physical performance of the warfighter. So a ketone ester can conceivably do all these things. It can prevent seizures. It can enhance cognitive function, we think. We'll be testing that. and it can enhance physical performance.
Mm-hmm.
And there's already some research, done at Oxford University and some research in the lab showing that, for example, mice and rats. Joe?
Yep.
Okay, I lost your video.
I think I lost yours too.
Okay, I can see you now.
Can you turn yours back on too?
My video, yeah, got it.
There we go.
Okay, so you want to ask the question again?
Yeah, I would just the ketone esters. Can somebody watching this interview purchase those, or is that just things that you're working on in your studies, or?
Yeah, as of this moment, the ketone esters are available on a website called KetoResearchChem.com, and I can send you the link to that.
Sure.
And that's a website set up for researchers like me that can purchase ketone esters or ketone salts for scientific research, ketone research. So investigators that are doing ketone research can purchase these. There's also a website set up. There's a ketone supplement available called Keto Force, and this is sold by Prototype Nutrition. And the chemist that has been assisting us in developing these products, has this product on the market, and it's a balanced mineral salt. So when it's consumed, it actually can replenish some of the vital minerals that your body has, kind of depletes during the ketogenic diet. And the ketone body itself is actually combined with various minerals. And when it's consumed, it can produce a state of ketosis without carbohydrate restriction, which is pretty much unlike anything out there. The only thing that can do that to a limited degree is medium chain triglyceride oil, caprylic acid, the 8-carbon medium chain fatty acid, can do that, and it can maybe elevate beta hydroxybutyrate levels, which is a ketone body, to half of a millimolar. Now, a ketone salt can go at least 5 times higher. So it can be consumed. You can, eat a normal carbohydrate diet, but I think it would be more effective if it's combined with a ketogenic diet to further elevate blood ketone levels. So what we haven't done yet is we've tested the ketone esters in different animal models, but we haven't thoroughly tested the ketone salts yet. But they are a more natural product because we combine the ketone bodies, which are found in food stuff, with various minerals. And so we should, be able to get FDA approval, and maybe this can be a medical food in the near future, but we know that these things are relatively safe, and the user feedback from people using the Keto Force product has been very good. So I think people are amazed when they can see they can actually get into ketosis, eating carbohydrates. But so for exercise performance, these are can potentially give a big advantage. And I'm working with some folks that are actually testing this in an exercise paradigm. And they consume the product, and they get on a bike, and what we've demonstrated, our preliminary results suggest that elevating blood ketones with a ketone salt can make the body more metabolically efficient. So you can do more work and consume less oxygen. And from an exercise performance point of view, that's a huge advantage. So it could be a very attractive, ketone salt can be a very attractive product for someone who's into, bike racing, marathons. And we think that it has, if someone's on a weight reduction diet, that the ketone bodies can spare muscle protein. So you could conceivably lose body fat faster and spare the muscle protein. So it may have, in that way, an anti-catabolic effect. So there's some reports in the literature on that. But Prototype Nutrition sells a product called Keto Force, and it's a product that we're testing in the lab right now, and have some really interesting data on it. We're actually testing it in a wound healing model, and we find that it increases blood flow to wounds, and it reduces oxygen-free radical damage in the tissues, and there's a lot of interesting, effects simply beyond providing a metabolic fuel, which the ketones are. They can enhance blood flow delivery to muscles and to areas that are not receiving as much oxygen as they could. They can promote oxygen delivery to the tissues.
Sure. And now, in addition to like the coconut oil and MCT oil, are there any other supplements that you've seen useful or effective in the cancer patients that you've come in contact with, or anything that you're familiar with as far as supplements?
Yeah, I don't like to push supplements that much. I think a few off the top of my head. I think fish oil can be, your staple fish oil product. It can have, when taken in moderate amounts, not excessive amounts, it can reduce inflammation, and I think that's good. EGCG, the component of green tea, or just a green tea extract, has been shown when taken with meals can help keep blood sugar maintained. I think, a baby aspirin a day. I think inflammation plays a big role in cancer proliferation. So I think a small dose of aspirin per day. Alpha lipoic acid, which is kind of a metabolic antioxidant, and it's a part of the pyruvate dehydrogenase complex, and it can help lower blood glucose levels, especially when taken with a meal. Alpha lipoic acid, or ALA. Acetyl L-carnitine can help transport fatty acids into the mitochondria. So on a ketogenic diet, you're doing more of that, right? You're transporting more fats to be burned as fuel. So acetyl L-carnitine is a pretty good form of that, and it's a form that I think is more permeable to the blood-brain barrier, so it can get to neural tissue. But besides that, I'm thinking that's pretty much all I take. Another supplement we've recently been studying, and we have some very encouraging results, are branched-chain amino acid product. And so branched-chain amino acids, there's a formula out there by Civation Nutrition. They put out a formula called Extend, and it's essentially branched-chain amino acids, citrulline, malate, B vitamins, and glutamine. And I've been working with the company, and we've we're modifying the original formula and testing it in ways to show that it can have an anti-cancer effect. We think so. The study is going on right now, and so at this point, I don't want to talk too much more about that, but I would like to kind of put out there that branched-chain amino acids in the form of leucine, isoleucine, and valine may have some unique anti-cancer effects, I can say, and I think it may be working through preserving lean body mass. So we have some encouraging data right now. The study is still running, but at this point, I think they're going to see a beneficial effect of a branched-chain amino acid supplement. And this was a little controversial. I was actually on Joe Mercola's website. I did an interview with him, and there's information that branched-chain amino acids are powerful activators of the mTOR pathway. So we know this happens in skeletal muscle, and that's why branched-chain amino acids are used by bodybuilders and by fitness enthusiasts to help preserve lean body mass when they're dieting. And the mTOR pathway is something that promotes cancer cells. So when I was starting this project, I thought I would see two things. I thought I would see either nothing happen at all when we give this high concentration of branched-chain amino acid into the standard diet, or I would see the tumors explode, and that and it would cause very rapid tumor growth. I didn't think that was going to be the case because I've gotten enough anecdotal reports back from patients suggesting that it really helped them. So I was thinking scientifically. The people who study cancer are saying that activating mTOR is going to make the cancer cells grow much faster. But we don't see that. What we see in the reports that I'm getting back that I've heard from patients is that it helped them get through chemo. They've used it to help them prevent the muscle wasting associated with cancer, cachexia, it's called, and they've used it to improve their health. Branched chain amino acids taken at like 5 grams per day, maybe 2 or 3 times per day. So these are pretty high doses. Maybe I wouldn't go that high. 3 grams per day of leucine, something like that, would be optimal, just to be safe until we really know the dosages. But I can say we're running a study right now, and we have encouraging data on branched chain amino acids as a nutritional supplement.
Sure.
So I can talk more about that when we complete the study and write the paper up.
Right, definitely. I'll be interested to hear about that when you get some results.
Yeah.
But kind of one other thing, do you, in your interaction with patients and in your field of research, have you found any, connection to the patient's mindset and their kind of emotional state and kind of the mental, the mental part of healing? Do you have any experience with that at all? Or?
Yeah. This is what I can tell you. When someone's diagnosed with cancer, they are overwhelmed. They are completely overwhelmed with not only the diagnosis and kind of what that entails. When you're told to go back and get your finances in order because you have 3 months to live, that's an enormous emotional, psychological stress, and then patients will contact me prior to hearing that, and I ask them to, and if they're interested in implementing this metabolic therapy, I tell them, well, first you got to start tracking your blood glucose and blood ketones. And when patients are in this psychological state, their blood glucose is very high, and that can be a combination of their stress hormones, cortisol, epinephrine. Sympathetic nervous system is just activated. They're likely not getting much sleep. But if a person can, and everyone has a different way to go about doing this, can develop a strategy to effectively psychologically deal with these things, whether it be exercise, meditation, yoga. I think all these things are great and should be implemented. Their faith is an important aspect of it. A number of patients very involved in their churches and their religion and very spiritually kind of grounded in that way, that their faith has been a huge factor in that. And, and that's a whole other topic of discussion. Faith can be an important in the healing process. But what I've seen from a scientific point of view is that if you believe that something is working, and if your faith is strengthened in believing that this metabolic therapy is working, and the faith in your religion or whatever methods you're using can help lower blood glucose. So, as a scientist, I have to look at, objectively at the data, and I have personal opinions on kind of how some of these other aspects may promote healing. But from the markers that we're looking at are the cancer markers, lipid profiles, and most importantly, blood glucose, blood ketones. You get those two things in range, these biomarkers, and that's where we can objectively say that it has an anti-cancer effect. And if the patient can, put themselves in a psychological state that's more calming, their numbers improve. And how they go about doing that is it's a more of a personal decision. And I'm a big proponent of exercise. Exercise can lower sympathetic tone, and it can activate more of the parasympathetic nervous system over time. And these things can promote a state of metabolic health that is in the right direction. But psychologically, I think it's very important. It's not my field, but I do have some personal opinions on it. I think a combination of approaches should be done.
Right, exactly.
Exercise probably at the top of the chain because it can kind of purge your body of a lot of toxins, and it just kind of resets the whole metabolic health. If you're sitting in front of a desk all day, which many of us are, by the time we leave work, we're like a caged animal, ready to exercise. And if we don't have a physical outlet, the food that we eat is going to spike our blood glucose, and it's going to float around and cause inflammation. I think we really need to burn the fuel that we're eating. And, diet is probably the most important, but I think exercise is a very close second, to that.
Definitely. Yeah, well, this has been a great interview. So much great information here. But do you have, say, somebody's watching this who's just recently been diagnosed with cancer? Do you have any pieces of advice that you would want to impart to them?
I would do as much research as possible. I think you need to. A lot of people ask, should I do standard care or should I do metabolic therapy? Well, I think you can do both. And I think if you're diagnosed with a type of cancer that has been shown scientifically to be responsive to the standard of care, which is chemoradiation, then you may want, if it's scientifically the odds are better if you do the standard of care, you should do it. But that's only a few cancers, that I know of. If you have a glioblastoma, if you have metastatic cancer, if you have a variety of other types of cancers, the standard of care has been shown to be relatively ineffective and can decrease the quality of your life. So I would ask patients to actually do research on, to read Tom Seiferd's book, Cancer as a Metabolic Disease, to do research on the ketogenic diet and cancer, to investigate hyperbaric oxygen, perhaps, and just kind of research the subject as much as possible, and to read the actual scientific studies. I try to put this information on a website, ketonutrition.org and .net. .net will have you can download some of the scientific studies to show. And we're in the process now of running several experiments that we'll be publishing. I know some of my colleagues are writing up case reports to show, to validate the efficacy of these approaches. And I think more research needs to be done. And, from my perspective, because government agencies, they're not very interested in funding this, I need to really stretch what little funding I have to do as much research as possible. So that's what we're doing now. I think patients really need to look at their own situation, their own health, and decide what the best option for them. But I think from my perspective, it's important to put out there that patients do have another option. So then it's an option that their doctors will never mention to them. That a ketogenic diet, restricted ketogenic diet if you're overweight, and hyperbaric oxygen may provide a health benefit. And I can understand kind of at this point why a doctor would not aggressively promote the use of hyperbaric oxygen for that. But we know the oxygen content or the efficacy of radiation therapy is proportional to the oxygen concentration in the tumor. So if a tumor is low in oxygen, which it is because it's growing so fast, and it's treated with radiation, it's going to be far less effective because the oxygen content is low. So the radiation more or less strips electrons off the oxygen molecules inside the tumor, and it's free radicals that do a lot of the tumor damage. So if we saturate the tumor with oxygen prior to radiation, it would make it work much more effectively. We know this, and a radiation oncologist know this too. If you ask them, would oxygenating the tumor make the radiation more effective? They would have to tell you yes, but they won't tell you to use hyperbaric oxygen. But they know this as part of their training. Right. So it's important for patients to ask, could hyperbaric oxygen be important for me? But the scientific evidence for a calorie-restricted ketogenic diet, or just even an ad libitum ketogenic diet, is already out there. Eugene Fine published a study. It was a recharge trial showing that the ketogenic diet is safe and effective for cancer management, and is a good option. And there are studies going on right now, that hopefully will surface animal work and some human patient studies that are being developed. So I think patients really need to do research, and that can be a stressful, time-consuming thing if you're just diagnosed with cancer, especially terminal cancer, and you're trying to get everything in order. So I think what we need to do is just get all the information packaged together, in a way that the patients can look through it and implement it as fast as possible. And the good thing about metabolic therapy is that it doesn't cost anything, right? So a patient can just simply do a well-designed therapeutic fast and a well-designed ketogenic diet, today, any day. They can start this immediately. And they need to be told that it's effective, and then in the weeks following, they can read up and share with their doctor the literature on that. And I think Tom Seifert's book is great because it's over the head of many cancer patients, and it's very technical. But at least it's a book that they can show their treating oncologist and say, here are the studies, here are the case reports. At the very least, it's not going to do any harm. So at least they would have to agree with that. But we know scientifically and through our experimentation that it's an effective approach for cancer management.
Right. Great. Well, I'll definitely put a link to the book and to many of the things that we talked about here in the notes with this video. And I'll make sure that I also include ketonutrition.org, where people can learn more about you and your work and kind of more about metabolic therapy and the ketogenic diet. But overall, thanks so much for coming on with me today. We've shared some great information. I know people are going to get a lot out of this, so thanks so much for talking with me.
Yeah, pleasure to be here. Thanks.